حتى لو بالعربي يصير له مو مشكلة. تفضلي بالعربي لو بالانجليزي. تفضل.
How long does the treatment take usually? On average, the treatment that they take for the drugs, how long does it take for them to recover?
That's a very good question. First of all, we need to decide what kind of drugs, because they are different. We mentioned like a group of drugs. So tell me which one you mean.
Heroin.
Heroin.
Yeah.
Okay. Which is the common and most important one. First of all, there are certain factors decide the length of treatment and the length of the process. Number one, I think there was a slide in the previous lecture. Number one, when the patient started using, what age? This is very important, because if the people get, drug use in early age, it's hard for them to get off it. Like if you compare like 20 years versus somebody who is like 40 years or 50 years who had surgery and took 2 couple pills of Percocet or so, it's not as bad as 20 years old who start using heroin. So the age is very important. This is number one. Number two, the amount. How much is using? If using like, quarter of grams, not the same if somebody using 3 grams. That's another thing. Number three, how do they use it? Do they snort it or they shoot it? Because this is another important thing. Number four, how many relapses the patient had? Like if the patient first time, okay, I'm here in the hospital, I have regret whatever I'm done, I'm ready to get it treated and get better and I will go to my life. Like the same case scenario with the lady who was like pharmacy student and what she did. Or somebody who was like back and forth in the hospital. You treat them, they go, and I've seen them every day. Treat them, detox them, they go to the community, they start using again, they relapse, they come back. Some of them, I asked them, how many times you've been in a treatment? They said 16 to 20 times. So this is another, frequent relapses is not good. Number 5 is the community. If somebody who lives in a very structured family, parents are there available, they are supportive, different from somebody who lives in the street or in a shelter or homeless. So all these factors, they play a role to decide the length of the treatment and the level of the treatment. Because sometimes I treat patients in my office, sometimes I treat them in the intensive outpatient, sometimes in partial hospitalization, sometimes in inpatient. And all these are levels of treatment, depends on the severity. So unfortunately, I cannot tell you like how long do you need to treat the patient. First, I need to tell you, or you need to tell me actually, who is the patient. So that's why the first thing I do is we call it motivational interview. I spend like 60 to 90 minutes with the patient, going on, many things and ask them, tons of questions, and then I can tell you roughly how long this can be.
Thank you.
You're welcome. Other questions?
Yeah, right here.
Yeah, please.
What are some major effects of like benzo or Adderall?
Benzos and Adderall, they belong to different families. Benzos, they belong to hypnotics and sedatives and anxiolytics. And they are under, this is the title, the family. Under these hypnotics, you see the benzos, which are Klonopin, Ativan, Valium, Xanax. These are all benzos. Adderall belongs to the stimulants. The effect of each one is different. Benzos, they work on GABA receptor in the brain, which I don't want to bother you with the meaning of GABA. But what it does actually, it makes the person relax and calm. So for anxiety, it's a good medication to help with anxiety. People, they like it, they feel, like if you heard people, I'm anxious, I'm going to give you a lecture today, I'm anxious. Hey, Sayyid Nazar, offer me Xanax. Take Xanax, you'll feel calm. I like the effect of it. I feel calm, confident, and so next time I start using it more and more and more, and you get dependent on it. The effect of benzos is similar to the effect of alcohol. And the withdrawal symptoms is similar to withdrawal symptoms of alcohol. Stimulants in general, or Adderall, it works on dopamine and norepinephrine. It's give you more focusing, attention, concentration. So that's why it's prescribed for the ADHD, attention deficit hyperactivity disorder. Even for kids, 5, 6 years old kids, who they have a problem to focus during the task in school, they give it to them and they do a good job with it. Dependence on that is different from this. Dependence on the stimulant and withdrawal symptoms from stimulant, it's completely different from that. Benzos, they are more serious. They need to be detoxified in the hospital because they might have seizure if they stop it. They might have high blood pressure, which that's why it's very similar to alcohol. A stimulant, no, you need to have a treatment, but not as intense as alcohol. And the withdrawal symptoms mainly like, because if you take stimulants, it suppresses appetite, so you don't feel, hungry. That's why some people, they take it because they want to lose weight, and they get dependent on it. And some, they take it for school. So when you stop it, you will have more appetite, and you will feel depressed and tired. These are the side effects of it. Okay? Yes?
What happens if your dopamine levels go to zero and you keep taking the
I'm
drugs?
sorry?
If your dopamine levels go down all the way to zero, and you get depressed and you keep taking the drugs, what happens then?
Yeah, that's a very good question. And this is one of the challenges we are facing with the drugs, especially with the stimulants and with cocaine. Because cocaine is working on dopamine. As we just said, dopamine is the neurotransmitter in the brain which is responsible for the energy, for the motivation, for desires, for enjoyment. So if you use a drug, what the drugs do, it goes to the neurotransmitters and squeeze the synapses and release this dopamine. So you feel high on the top of the world. You can do many things. The next day, you use more and more and more and more. At the end, then you have almost none dopamine. So you feel depressed, sad, unmotivated. You don't want to do anything, isolating yourself. You don't even take shower. You don't want to go out. You don't want to go to school. You don't want to talk to anybody. And you develop severe depression. If you remember one of the slides, says substance-induced mood disorder, which means you are not depressed, but you made yourself depressed because of the drugs. So in this case, what we treat, we give more dopamine to you in medication, like Wellbutrin is one of the medications. So we give you medication to build up your dopamine in your brain and make your brain manufacture dopamine more to get you back to your baseline. But this is very good question. Thank you. Yeah. Yes, please.
Let's say you take, I don't know, taking it for when you're a child and it's prescribed. When you've taken it for many years and you try to stop taking it, will it still affect you or what will happen?
When we talk about drugs in general, we have to differentiate if you take it as prescribed and monitored. Like I have tons of patients who are on Adderall, but I monitor them. I monitor the dose, I monitor the side effects, I monitor their school performance, their grades, so it's under my supervision. So in this case, if you are following with the doctor, don't worry about it. The problem when you take this medication, you get it off the street or offered you by somebody who is not like a provider, and you start taking it. In this case, there is no control. You don't know how much you need. You don't know what kind of stimulant you take. But if you take it, and I have cases, I'm treating them, they are prescribed since they were 5, 6 years old. And now they are in college. They are doing well, they are productive in their life, they are not abusing them. If the person starts using more than prescribed, or get it illegally or off the street, or this is where the problem starts. This is where the problem starts. But don't worry about that. I don't, I'm not telling you, you should stay away from all stimulants. No. But don't take it, unless it's prescribed and monitored. Thank you. More questions? Yes, ladies.
Okay, so you said people with a structured or supportive family usually don't use drugs as much. So why did the lady that had a dad that paid for her treatment?
Yeah. First of all, I didn't say the structured family they don't use. I said one of the factors determines the length of a treatment is how much the family is structured, because they are supportive. But going back to your question, her family wasn't structured. I know her dad was a doctor, but she's not living with them. She lives by herself. So the only time she sought kind of help from her dad when she needed that for the hepatitis. So they are not, they live in two different worlds. If you say like, if I say somebody is doctor, doesn't mean like he's, supportive to the family. The job, it doesn't mean anything. Some people, they have like simple job, but they are available for their kids, for their wives, they are very supportive. So don't be misled with the job itself. So he wasn't available for her. Or to be fair, actually, maybe she is not available for him because she lives in a different way. He kicked her several times because she's using. He told her, how the American life. If you want to stay under my roof, you have to go with my rules, right? So if you are not listening to me, if you continue using the drugs, you're out. So this is not support, right? You agree? Shukran. Okay. More questions? Yes, please.
Do energy drinks have the same effect on drugs?
I'm sorry?
Do energy drinks have the same effect on drugs?
Okay, that's a very good question. Energy drinks, they are more stimulants, and they are saturated with caffeine plus some vitamins like B12, thiamine, and other B complex vitamins. The risk of them is similar to the risk of caffeine. Inshallah, Ramadan is coming next month, and you see if you get used to drink caffeine every day before you go to school, and then Ramadan, starts, so you can't drink caffeine, right? So what do you feel? You feel headaches, right? You feel tired, you cannot focus, sometimes nervous, right? So all these are withdrawal symptoms from caffeine. They are exactly the same with the energy drink. The energy drink also has more other herbs with it. So if you take it more than usual, more than normal, you might have like intoxication, which you feel very anxious, restless, edgy, irritable sometimes, snappy, all these because of the intoxication of the stimulants. You have to know how much you need. That's the bottom line. Okay? More questions, please. And we have a question. Be courageous. Go ahead. Huh? You want me to ask you a question?
I got the question.
Sure.
بس أسئلة بالعربي.
أسئلة بالعربي.
لأن احنا هنا مقسمين قسمين، قسم آباء وقسم أبناء. ما عندنا حد حالة وسطية. فالشباب اللي هنا معظمهم شباب جيدين. يعني إن شاء الله كلهم جيدين الشباب، ما بعيدين عن الدراجز. لكن يروحون إلى مدارس معظم الشباب بها مختلفة. يروحون إلى مدارس كل واحد بها مدرسة بها مئات. وأكو من ضمن الشباب من يتعاطى الدراجز بطريقة أو بأخرى. شنو افضل اسلم طريقه للشاب اللي موجود هنا اللي يكونوا زينين ان شاء الله والحمد لله شكرا حتى يبعد نفسه عن الدراجز، هل يكون ناصح للولد ام مبتعد عنه، وخصوصا في الامر هذا يكون الانجذاب اقوى للشباب.
Did you understand the question? Please. نص. Okay, I'm gonna translate it to English. He's asking, all the youth here, inshallah, they are very good and they don't have anything to do with the drug business. But how do we protect them? How do we make them immune if they go to public school? And most of those, not most, some of those kids, they are using drugs. So which way, how do we protect ourselves? So I want you to answer this question for me. I'm sorry?
Teach them correctly at home.
Okay, that's one thing. So the home environment, the relationship between the siblings and the parents. تريدنا نجاوبها بالعربي ولا بالإنجليزي؟
doesn't matter.
Okay. Yeah. One more idea. How do we protect ourselves in school if we are not in a healthy environment? Yes, please.
Don't be friends with people that use drugs.
Don't be. I'm sorry?
Don't be friends with people that use drugs.
That's very good. Peer pressure. That's peer pressure. So usually when I treat my patients and before they go discharge, we do this what we call the discharge plan. I ask them first, change your number or delete the numbers of all the friends between quotation marks. They are not friends, they are enemies. Of all those people who they are using with you. So yes, stay away from those people. That's very important. If you see them they are using, or if you see any sign of drug use, stay away from them. If they approach you, you can provide, advice to them. No, you need a treatment. I care for you. You need to have a treatment because you're gonna ruin your life. You're gonna lose your life, your social life. You're gonna be in legal trouble. You're gonna lose a school. Your parents is not gonna be proud of you. Try to talk to him in a negative way. So they feel that because when they are in the middle of the problems, believe me, they don't understand what's going on. But after they get detoxified and clear, they understood what was the problem, how big was it, and then they start thinking clearly. Yeah. More ideas. So we said avoid peer pressure. We said family support. Yes, ma'am.
Teach them about the consequences.
Excellent, excellent. The consequences. And that's why the reason I gave you the pictures. I didn't mean to scare you, but this is actual pictures of patients. Those people, they don't have a problem to start with. They are healthy individuals like us. But all of a sudden, they have all these serious medical problems: hepatitis C, AIDS, liver cirrhosis, hemorrhagic pancreatitis, this guy with the cocaine, massive heart failure, and intracranial bleeding, and he's 35, healthy, ended up in a wheelchair. What a disaster, right? Any more ideas?
Stay out of the school bathroom.
I'm sorry?
Stay out of the school bathroom.
Stay what?
Stay out of the school bathroom.
Stay out of the school bathroom. Because?
That's hookah lounge, no?
Right.
It's not a bathroom.
That's a very good point. Yep, I've heard a lot of story with that. And even sometimes, not just the school actually, the gas station's bathroom. I had a couple patients who found, collapsed and overdosed in gas station's bathroom. They called 911, they gave them Narcan, they took them to the emergency room, and then ended up for the treatment. Yes, that's true. So basically, you need to stay away from places that you shouldn't be there. Stay away from the people that you shouldn't hang out with. Try to be smart and identify the problems if something going around you. If somebody you feel there is like abnormal behavior, you have to focus on that. You have to address that issue either with your parents or with friends that they are really good friends. So this is very important. Yes, sir.
Don't ever take stuff from people that you don't trust.
Excellent point. Excellent point. You remember we talk about self-medicate? So I'm anxious. Take this, that's gonna help you. I have pain. Oh, I tried this pill. This is very good. Use it. No, don't listen. Don't listen to anybody offer you any medication. That's very, very good point. Thank you. Yeah. Yes, please.
About the thing you said for the vaping in the bathroom. Like nowadays, people have to pay like $500 to $1,000. They actually passed a law because in my school, they found hundreds of students with vapes. The teachers, they take them, they fine them $500 to $1,000, and they throw away their vapes. And I've heard a lot of stories from a lot of people, like they're mad at the teachers, but everyone I know, they're glad that they're doing that because like people are starting to vape and it's hurting them because it destroys their lungs, destroys their heart.
Absolutely.
Yeah, and it causes holes in their lungs, which makes them suffocate and all.
This is actually unfiltered going directly to the lungs, so it's more hazardous. You're right. You're absolutely right.
Jafar, share your idea. Come on.
I'm just listening.
Okay, Jafar, do you agree or disagree? Good. That's a good point. Any ideas or questions? So we learned from questions more than the lecture itself. That's why I wanted to be more interactive. Yes, please.
coming up.
MashaAllah.
يعني
براحتك تتكلم عربي انجليزي ايراني شو تريد براحتك.
هو الدكتور الطب
ايه
يعني هو there's still drugs مو ليش يختلف
The prescription drugs
versus the drugs.
يعني الدواء عن المخدرات.
صحيح. The doctors they don't prescribe all the drugs. Maybe they prescribe the painkillers, but they don't prescribe hashish. They don't prescribe
Medical
cocaine.
marijuana.
They don't prescribe heroin. They don't prescribe alcohol, right? So maybe this is applicable for the painkillers, for stimulants, like we take it for ADHD and the Adderall, or for the benzos for the anxiety you mentioned.
But they also give out medical marijuana for cancer patients.
These are certain cases, like severe, people with cancer, severe loss of appetite, severe pain, and this is supervised. And I disagree with that, to be honest with you. So, not all the drugs we talked about, they are prescribed by the doctors. But some of them, which are prescribed by the doctor, they are abused. That's the difference between use and abuse. Like if I give you a prescription and I'm the doctor and I'm telling you, what's your name? Karar. Habeeb Arar. Take this pill 3 times a day. Okay? You come back after like a week. Hey doctor, I